Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Every year, more than 32,000 people right here in the United States are diagnosed with multiple myeloma. It's a cancer of the plasma cells. Relapsed refractory multiple myeloma is very complex because patients relapse. They can become resistant or refractory to their therapies. Well, joining us today is Dr. Saad Usmani with the Levine Cancer Institute and Robert Pugh. He's living with this difficult-to-treat disease. Welcome both Dr. Usmani and Robert. Thank you for taking the time this morning. Dr. Usmani, first of all, what exactly is multiple myeloma?
Multiple myeloma is the second most common blood cancer that occurs in the United States, and it occurs when cancerous white blood cells called plasma cells grow uncontrollably and crowd the normal plasma cells and other blood cells in the bone marrow. And patients can experience various symptoms, including bone pain, weakness due to low blood counts, and recurrent infections, amongst other things.
Now, I mentioned a form of multiple myeloma called relapsed refractory multiple myeloma.
So when patients are diagnosed for the first time and undergo treatment that puts them into remission, that remission can last for variable degrees of time. When the myeloma recurs, despite having received prior treatment, that's called relapsed refractory myeloma.
Robert, when were you first diagnosed and what were some of the outstanding symptoms for you?
I was initially diagnosed in January 2014. I was preparing for a 15K race, and I went in for my routine physical, and at that point the doctor recognized that my white blood cells had been going down, and he ordered more tests, and that's when we found out that I had multiple myeloma.
What are some of the causes, doctor, or is there a single cause? Is it genetic?
No, myeloma is considered to be a disease of older age, so most folks, when they're diagnosed, are in their late 60s or early 70s. Even though there's no one particular cause attributable to developing this cancer, but it tends to be more common in men and in African-American folks than in others.
Are there some markers that can indicate it early in its development or maybe the potential for development?
So, when folks have low blood counts or an increased susceptibility for infections or kidney problems that are unexplained from more common causes, it's important to talk to your healthcare team about the possibility of multiple myeloma.
Robert, would you have considered yourself among those at risk before? Now that you know about the disease, were you at risk before? Did you know that?
No, not at all. At risk, as the doctor mentioned, there's nothing on record that says this or that is going to create myeloma. So no, I was very healthy. I was running I was a runner.
So you're still actively running. The treatment, I suppose, is working for you.
Yes, one of the important aspects about this, of as you communicate with your doctor and openly communicate, they take into consideration your lifestyle, your health, your nutrition. All of these things have to be considered as you continue to go forward, and good decisions are made within that group as you communicate.
Dr. Robert was totally healthy, still active and healthy. What are some of the risk factors that someone in the age group that you mentioned should start to be concerned about?
So if you have family members who've had this disease, called multiple myeloma, it may be a good idea to alert your physician that there is a family history, even though there's no specific genetic link. And just as Robert indicated, his myeloma was discovered when his doctor looked at some blood abnormalities, and he did not have any symptoms. So, if there is unexplained low blood counts, such as in the case of Robert, or kidney problems, that's when doctors start thinking about multiple myeloma and doing additional workup.
Robert, is your multiple myeloma the relapsing type? Have you had bouts with it and then felt fine for quite a time?
No, I have not. From the initial treatment, that's where I've been, and my doctor has been very attentive to how the medication and how my body and so forth is responding. See, my doctor is smiling.
Well, Dr. Usmani, what steps should patients take if their multiple myeloma does relapse?
Because this is still considered an incurable cancer, it's very important for patients to work with their healthcare teams to find the best options available for them.
You say you're still running. Are you still running at the level that you were before your diagnosis, Robert? And how has your life been impacted in other ways now that you're living with this incurable disease?
Well, to answer the first question, no. I did do a 15K this year, and I was very proud. It took about 5 years to get back to that point. My life has changed in ways that you have to find this term they call a new normal, where as you monitor your day-to-day life, your energy level changes. You have to pay attention to the nutrition, to your health, and education. There's so much information and conferences and workshops that I've had the privilege to attend to. Mm-hmm. And so with that in mind, I've been able to share with other patients so that they can, take responsibility, communicate with their medical team, and just be responsible for that part of their lives.
Three excellent points right there. Is there anything else that you'd like to add about talking to patients to help them overcome some of the challenges that you've been able to conquer?
I can't emphasize enough the open communication, the small things that you will learn from your caregivers, from your medical team. Just the small things about your sleeping habits, about just small things, that you have to do. And so I would really say develop the relationship and know that it's going to be a healthy, long, mutual relationship with your medical team so that you can continue to advance and make good decisions about what is the best way to treat yourself.
Dr. Usmani, as we close, give our listeners a website where we can learn more about this disease.
If the listeners want to explore more details about myeloma and treatment options, they can visit mymyelomaoptions.com.
All right. Well, Dr. Usmani, Robert, I thank you both for joining us here on Health Professional Radio and getting up this early.
Thank you so much for having us.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Saad Usmani and Robert Pugh. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.